Welcome to my YouTube channel, Indian Anatomist. Hi medicos. Today we are going to discuss the Norma Verticalis of the skull. Norma Verticalis is the superior view of the skull. In this view, the superior or vertical view of skull is typically oval in shape. In Norma Verticalis, the posterior part of the skull is broader than the anterior part in vertical view. Now, what are the bones forming the Norma Verticalis? It's very simple. 1. Anteriorly by, upper, or squamous part of frontal bone. 2. On either side by right and left parietal bones. 3. Posterior by, uppermost part or squamous part of occipital bone. The skull bones are united by a specialized fibrous joint called sutures. What are the sutures seen in Norma Verticalis? 1. Sagittal suture. This suture separates the right and left parietal bones and it is situated in the midline of the skull. 2. Coronal suture. This suture separates the frontal bone in front and the parietal bones behind. 3. Lambdoid suture. This suture appears as lambda symbol. It separates the two parietal bones in front and the occipital bone behind. The lambdoid suture continues laterally with occipitomastoid suture on either side. The lambdoid suture is clearly visible on occipital or back view of the skull, that is Norma occipitalis. What other features are seen in the normal verticalis? They are: 1. The upper part of superior temporal line is visible on the lateral part of the parietal bones. The below pictures is Norma lateralis or lateral view of the skull showing the entire superior temporal line. This is for your convenience. 2. Bregma. It is the midline bony landmark where the coronal and sagittal sutures meet. In fetal or newborn skull, the bregma represents the anterior fontanelle. 3. Lambda is another midline bony landmark where the lambdoid and sagittal sutures meet. In fetal or newborn skull, the lambda contains the posterior fontanelle. Now what is fontanelle? In fetal or neonatal skull has a softer region that is seen on the top or lateral parts of skull. These soft patches are membranous gaps between the skull bones that are not fully formed. Fontanelles permits the skull to be molded during delivery and helps the baby's head emerge after parturition. These smaller gaps or patches or spots are typically closed by the age of 2 to 3 months, except for the posterior fontanelle, the future lambda that closes by the end of 6 months after the delivery. Whereas the anterior fontanelle, the future bregma will close by the end of 18 to 20 months after the birth. 4. Parietal eminence, also known as parietal tuber or tuberosity, is a prominent centrally placed region on the outer surface of the parietal bone. The maximal convexity of parietal bone is present here. The below picture shows the posterolateral view of the skull showing the parietal eminence. 5. Parietal foramen, also known as parietal emissary foramen, an inconstant foramen seen in parietal bone on each side of the sagittal suture. If present, it transmits the parietal emissary vein to the superior sagittal sinus in the cranial cavity. 6. Abelian, it is a craniometric point on the sagittal suture between the right and left parietal emissary foramen. At this point where the sagittal suture closure begins. In Greek, obelos means the symbol division. Dear students, the Norma Verticalis is completed. In brief, the normal verticalis shows the following features. They are: 1. Frontal bone. 2. Right and left parietal bones. 3. Occipital bone. 4. Sagittal suture. 5. Coronal suture. 6. Lambdoid suture. 7. Bregma. 8. Lambda. 9. Parietal eminence or tuberosity. 10. Abelian. And 11. Parietal emissary foramen. Dear students, the Norma Verticalis is completed. Hope you all liked this video. Thanks for watching my channel, Indian Anatomist. Please like, comment, share and subscribe. Good day all.